Hey everybody, I'm so sorry that we are having to get back together in this format instead of me being there with you. I hope you guys all had a great Christmas break. Ours was really good until this past Sunday. Um, when my daughter got really, really sick and she tested positive for COVID on Monday. So, as of right now, if me and my husband can keep from getting it and my little baby daughter, my 7-month-old, keep from getting it, I'll be back to school on the 15th. Until then, I'm going to be teleworking. So, we'll be doing videos and lectures and things like that. I know that that's a little bit harder for us because we need to be hands-on. So you guys are going to have to do your best to watch in videos and kind of work together. I'm kind of counting on y'all with how good y'all have been being in class and all of that to be able to handle doing some telework. We don't have to do live Google Meets. I'm going to try and do as much recorded like this if I can, just because I am home quarantined with both of my daughters and my husband. So it's a little bit hectic in my house. However, next week, like by Wednesday or so, if we really feel like we need to, then maybe we can try and do a Google Meet with the chaos that is here. But today we need to intro our next unit. Decided to go ahead and start the shoulder instead of doing the spine and head because I want to make sure I'm there for all of the spine and the head. There's a lot that goes into that, and I don't want to try and relay that over the computer over videos like this. So we'll start with the shoulder. It's a huge problem area. We see it in almost all of our overhead athletes if you think about it. But we need to get down to the basics with this. So, as always, we are going to start with anatomy like we normally do. So, we will try and do an anatomy quiz either next Wednesday or next Friday. We'll kind of see how lectures go and how you guys are feeling, whether it's Wednesday or Friday. We'll decide by Monday. But let's start out with some of the basics. As far as the shoulder goes, the actual bones that make it up are the scapula, the humerus, and the clavicle. Okay. We're going to do our best to refer to them in those terms instead of using collarbone and shoulder blade. Let's try and use our technical terms for those. So try and keep that in mind. But as we look at these a little bit further, let's look at the parts of these bones that really matter. So on the humerus, there are really 4 main pieces that we're going to be looking at. It has a greater and lesser tuberosity, which are very similar to the greater and lesser trochanter that the femur had. Okay. They're not as big of markings, but they are still there. And when you are looking on yourself, they tend to be in the front. So if you externally rotate your hands, so palm out, and you kind of do one of these motions, can't really see, but rotate outwards. So almost like you're throwing like this, you should be able to feel the greater one just on the inside part of your shoulder. The lesser is much harder to feel. So don't be alarmed if you can't feel that one. Now, the deltoid tuberosity is right about the halfway point of your humerus. If you think about somebody who has really good defined shoulders, where the deltoid ends, where that rounded muscle comes to an end, is where that deltoid tuberosity is. And then the bicipital groove, which is where our bicep tendon runs, it's between the greater and lesser tuberosity. So it's right in that space right there. Be careful, don't poke around too much in that space. It will get really tender because of that tendon that runs through there. And then, as always, we've always talked about, mentioned the ends of all of our bones are covered with cartilage. That is how they don't rub bone on bone within the joint. Now, where the head of that humerus comes in contact with our scapula, can't touch that part, but we know that that's where they come together. We call that the glenohumeral joint. We'll go into why it's the gleno once we start talking about the scapula. But the humeral obviously is named from our humerus. Now, I had a surgeon once describe this joint as a golf ball sitting on a golf tee. And that is really the best way to think about it, is that it is not all encompassing the way that the hip is. Because if you remember the acetabulum wrapped around the head of the femur, that is not the case. It is literally a shallow cup and the ball just sits right on top of it. So golf ball sitting on a golf tee is the way we want to think about our shoulder joint. So yet again, in case you've forgotten, that's where our humerus sits. And then on this picture, if you will look, we've got the greater and lesser tubercle up at the top. You've got the space between them that we call that bicipital groove. And then that deltoid tuberosity, you can't really feel it. However, it is at that halfway point. There's tons of other stuff on here. Don't worry about it. We'll talk about a few of them at the elbow, but for now, just focus on those ones I've already listed. So that glenohumeral joint is a ball and socket joint, okay, which means we've got full circumduction. We can go in full circles with that. The glenoid fossa, which we'll talk about more, like I said, as soon as we get to the scapula, but that is the socket part of this joint. So that is the golf tee in our analogy. Now, your shoulder has a labrum the same way that your hip did. It is much more easily damaged. We see it damaged all the time, but it is the same, similar to the meniscus, very much like the labrum in the hip, okay? Fibrocartilage, it wraps around the cavity. It helps with stability. It also helps with shock, especially if we're dealing with athletes that have to put all of their weight onto their arms, such as things like gymnastics. Now, your clavicle, everybody should be able to find your clavicle. It starts up towards your front. You can finger walk all the way out to the top of your shoulder. It is S-shaped. It only takes 5 pounds of pressure to break it. It's because of its S shape that it is so easily broken. It connects from your breastbone or your sternum all the way out to the acromion process of your scapula. So it's actually scapula to sternum. Now, as far as which end is the sternal end and which end is the scapular end, I'm not worried about you understanding that. I do just want you to know that there is a joint at both ends. So where it meets your sternum, we call that the SC joint for sternoclavicular. And then where it meets your scapula, which is right on the edge of each shoulder, that it actually meets the acromion process, which is just a piece of the scapula, but where those meet, we call that the AC joint or the acromioclavicular joint. Now, those are very, very important joints. We're going to come back and talk about this joint a lot. So just prepare to know that we're going to talk about those a lot. Here is just a close-up of just that clavicle. Now, our scapula, this is a very important part of the shoulder joint, and it tends to get neglected. So we know it's a flat bone. We know it kind of is shaped like a triangle. I always tell people to kind of think about your hand being on your back, okay? Kind of how your shoulder blades are sitting. They're flat. Now, where they come over the top, they do have some projections. On the next, we'll kind of look at that here on this picture. I know that this is a two-dimensional picture, so kind of use your imagination. We'll look at our skeleton, or you guys can look at it while you're in class. But we have two projections. One is much lower, and it's kind of in that deep place where we were feeling for our greater and lesser tuberosities. The other one is that acromion process that is right on the top of the shoulder, okay? You can feel the acromion process very, very easily. It's right here on the top. That one, super, super important. But if you look, you can see we do have a triangular shape. We do talk about it as having borders. So the medial border is also called the vertebral border because it's the part that's right next to our vertebral column or our spine. The lateral border is also sometimes called the axillary border, and it is the part that is closer to our armpit. So it's more on that outside bit. And then as far as the angles go, we have the inferior angle, which is the bottom point, the very pointy part at the very bottom of it comes pretty far down your ribs. And then we have the superior angle, which is up at the top, closer to your spine. Okay. So Thinking about those, like I said, we've got the coracoid and the acromion. They're big time attachment sites. They make joints. They're very important. We'll continue to talk about them. Other than that, you can kind of see the glenoid fossa here in this picture. It's really shallow and flat. Like I said, it's kind of like cupping your hands like this. It's like that golf tee. The other thing is that you've got, and I like this picture because they have it marked in red. You can see it better. So all of this that's red, this is where your muscles attach. Every red spot is where a muscle attaches. Okay. So we call those, though, and you can kind of see the one on the top. It's very hard to see. We call them fossas because they are flattened, depressed areas, but they're named for the muscles that go there. So it's kind of nice. We can refer to them fairly easily. On the posterior side, you have the supraspinatus fossa, which we can only see the top of it there. We have the infraspinatus fossa, which is this one on the bottom. We'll talk about these later on as we get to the next muscle groups. Those are other muscle attachments. But these two fossas are separated by a very important part. This is the spine of the scapula. It sticks out quite a bit. It comes all the way across and it curves forward and becomes the acromion. Okay, so that whole thing curves across, and then what you can see here is that you can see the collarbone where it's meeting the acromion. So that would be the AC joint. So here's another front and back picture. So you've got your glenoid fossa. You can see the acromion here from the front, the coracoid, and then as we turn around, you can see how the acromion and the spine essentially are one piece. On this anterior side of the scapula, this is also a fossa. Obviously, we can't see it when we're looking at it here because it's the part that's underneath. It's actually touching the ribs. Because it is underneath the scapula, we call this the subscapular notch. Sub meaning below. So think about like a subway. It's below ground level. It's underground. Now, this is more for you to refer to later on. It's just a breakdown of motions, muscles. We haven't gotten into it yet. This is just for your information as we move forward. And then let's quickly refer back to some of these joints that we have already talked about. Move some of this out of the way. So we've got the acromioclavicular joint. It is here in green. It is very strong. There's lots of ligaments that connect that. We have the glenohumeral joint where the glenoid fossa is. Obviously on here we don't have the humerus, so you can't see how it connects. And then in this pinky purple, we have this sternoclavicular joint. Now, this joint is incredibly strong, okay? This joint is so strong that you are more likely to break your clavicle than you are to dislocate this joint. It actually has an articular disc that sits inside there underneath those ligaments, kind of like the labrum, but it helps to keep those joints connected. So it is very, very strong. Then in the blue, it's trying to show you that the coracoclavicular joint, so it is just showing you that the clavicle is connected to the coracoid process by two very important ligaments. And we'll start referring to them a little bit more as we get into naming all of the ligaments, okay? But these are important, and this is considered a joint because when this breaks, if these ligaments are broken, the clavicle kind of floats up. It's very awkward, like it literally sticks up off your body if you tear these. So these are an important part. And then what it has this dotted line right here that's yellow. And what it wants you to realize here is that where your scapula sits on your rib cage. So if you go back to sorry, my computer's not working. If we were to go back to our picture where it's sitting on our ribs and we can actually see it, where your scapula interacts with your ribs, that is actually considered a joint. Because when we move, whether we're shrugging our shoulders, whether you're pushing your shoulders downwards, whether your arms are up above your head or you're coming out to the side, your scapula actually moves. It glides on top of these ribs in order for those motions to happen. So we consider that a joint, and it is called the scapulothoracic. If you remember the thoracic, that's kind of your trunk cavity, your central part of your body. Those ribs are actually your thoracic ribs, part of your thoracic vertebrae. So that's where that name comes from. If this joint is not functioning properly, you actually will have what's called frozen shoulder, and you would not be able to raise your arm above 90 degrees. Once you get above 90 degrees, if your shoulder blade, if your scapula is not moving, you've got no movement. Okay. So I actually want you to take a minute, and I want you to get a partner at some point today when you all finish watching this, and you're going to put your hands on their shoulder blades. Okay. So if somebody was in front of me, I would set my hands on top of them, on top, just, you don't have to be skin to skin, nothing, just on their shirt. Hands are there. And then they're going to do different shoulder motions. So think about shrugs, and then standing normal, and then pushing your shoulders down like you're pushing downwards. Then do like arms down at your side and bring them all the way up, almost like a jumping jack, all the way to the top. And the person that's hands are on there, I want you to feel how they move up and down and how they actually turn inwards and outwards. The last movements I want you to have the person do is to pinch their shoulder blades together and then do a hugging action, because that actually makes them pull apart. And so I want you to take turns doing this, because I want you to see just how much our shoulder blades are going to move. And that's usually something that we don't think about. Now, as far as this is concerned, we're going to stop right here. We're going to go through these joints. I want you to practice doing that. And then I'm going to have an assignment for you to do that just is kind of an intro to these first few things. And then I'll have another video for you on Friday. Okay, if you have any questions, any problems, shoot me an email, add a comment on Google Classroom. I'm here. I'm technically teleworking, so I will be able to answer any questions, any problems that you have. You just got to reach out to me as soon as you need me. Okay, so with that being said, just let me know what you need help with.